It is a gradual onset, so the doctor tells me, but I got to the point where I had extreme difficulty reading, and that what finally triggered it mostly was I would have to ask Margaret, my wife, when we were a good distance from the traffic lights, is that light red or green? Now, when I got close, I could tell, and I also couldn't read the road signs till they became closer. And then, as I mentioned, reading was almost impossible. Previous in the seminar, we were impressed with his presentation and the fact that he seemed a very outgoing type person, and he was relaxed with the audience and was obviously knowledgeable. So in the surgery, I don't remember the surgery itself because I was under sedation, but he did a good job. When they brought me back to the room here in the hospital after surgery, I looked up and I could see the clock. I could see it very plainly. So, and I mentioned to the nurses there, it was quite a revelation, and to Margaret. I said, well, I can see the clock plainly. Say it was first rate, wouldn't you, Margaret? I'd say it was first rate. I did mention to the doctor and to some of the staff. The staff were very professional, and I thought competent. But one thing that did impress me was they were congenial with each other, and I thought that was impressive. To me, having been in a situation where I had lots of staff and worked with lots of people, that's important. Not only were they professional, but they were nice to each other. So I was impressed with that. To have it without reservation. As I look back, it was rather insensitive of me not to have it done sooner, because there are other people occupying the highway, not just me. So in retrospect, I thought, gee, I should have done this before. Not only for my sake, but for the safety of others. So and to further answer your question, I would have no reservation about recommending the procedure. In fact, we're going to have the other eye done this fall.